Hi everyone, Dr. Kerry Yerke here. Today I'm talking about chiropractic and what would you like to know about chiropractic? A lot of people have questions about it on social media. Sometimes they're wondering, what can chiropractors do? And so here I'm on this. I'm on live on Instagram as well as here on YouTube. And if you guys have any questions, feel free to write them in the comments right now. People often do have questions about chiropractic. They're wondering what chiropractic does, how we can help people. I'm going to put my link tree in here as well for you guys. So just trying to multitask and going to put that in the chat so you can easily click on that link and then go ahead and see the different products and services that we have here at the clinic. Chiropractic is an art, it's a philosophy, it's a science, and it all revolves around the spine and the skeleton. So the structure of the body is really important to chiropractors. We look at the alignment of the body structurally, and then our goal is to realign the body. So that's pretty simple. It does get a little bit more in-depth or complicated when it involves the nerves. So sometimes the nerves start to get pinched because of the misalignments, and that can cause pressure on the nerves because the nerves come out between the bones, and when a bone shifts, we call that a subluxation. So that misalignment, the term is a subluxation, and that can put pressure on the nerve, affecting the nerve flow going to other areas. Like when there's a bone out of place in the neck, it affects the nerve flow going to the arm potentially. When the nerves are pinched in the upper part of the neck area, you can get headaches. When the nerves are pinched in the lower part, the lumbar, sciatica. So you've heard of some of these terms before. And what we want to do is realign the spine to take the pressure off the nerves so you don't have that pain and discomfort. The other thing is when there's misalignments, there's muscle spasms. And those muscle spasms can happen to accommodate for the shift or the position of the bone. So when the bone changes position, the muscles have to contract on one side of the spine and elongate on the other side to adapt to the structure underneath. So you're going to get muscular imbalances. And sometimes people try to massage those out or stretch them out, and it doesn't work because underlying or underneath that, the bone's out of place and the muscles are attached to the bone. So it just makes sense that the muscles have to adapt to it. And then that does cause swelling. So you're going to get inflammation in the area, and that inflammation can be in the soft tissues, but it can also start to irritate the nerves. And that's when people have a pain and discomfort. We can see a visual kind of puffiness or fluid retention in the area. Just had a patient yesterday, and he had quite a bit of inflammation under his heel bone, like where the Achilles was. And I'll talk about that in a second. I'll show you something else, another diagram, but he had like Achilles bursitis, and that's because the tendon was rubbing on the bone and the bursas in between, causing the bursa to swell up. So that's called bursitis. If the nerves get pressure in the spine, it can also affect the nerve flow to the organs. And this week I had a patient that had a disc problem at T5. And because of the disc problem at T5, it was causing poor nerve flow going into the stomach. And that was causing problems digesting food. So just indigestion. So the misalignments can be painful in the area, but also it can go down line wherever those nerves go. Sometimes I refer to the spine as like a breaker panel, a circuit breaker, and so if that breaker goes off, it's going to affect the nerve flow from that part of the spine to the other areas of the body, right? What else? Chiropractors also work on other joints. So we call those the accessory joints. So sometimes people have a misalignment in their shoulder, and that can cause a rotator cuff because the muscles going around the shoulder are the rotator cuff muscles right here. So those rotator cuff muscles can start to tighten if there's misalignments, same type of principle. That affects the rotation of the shoulder, and the tendons can get pinched in between the bones, causing inflammation of the tendon or tendonitis. And then we get rotator cuff tendonitis. So we do see quite a bit of that. The knee, we see quite a bit of knee problems here in the clinic. Ankles and feet lately, more than normal. People with like soccer injuries, midfoot, somebody stepped on the midfoot, caused a misalignment in the tarsal bones, like these ones right here, cuboid and cuneiform bones. Don't want to get too technical with you guys, but if you're familiar with anatomy, these bones can get shifted or out of alignment. The Achilles, which I was telling you about, the Achilles tendonitis, that's another common one. Plantar fasciitis, probably the most common condition we see is plantar fasciitis, where the bottom part of the foot is inflamed, and that's the plantar fascia. And when it gets swollen, we call that plantar fasciitis. And we want to check the arch of the foot. A lot of times people are pronating, so their foot's turning inward and they're losing their arch, stretching that arch out because they don't have the arch support. And that causes stretching of the tissue, causing inflammation and injury. So we treat that with adjustments to the bones to restore the arch, but we also use instruments like the laser, which is light therapy, and then shockwave, which is sound therapy to heal that tissue. We also recommend orthotics. Sometimes just like off the rack orthotics are good for that. And then sometimes we have to do custom made ones. The healing process, it does take some time. So if you have misalignments, I'm just showing a picture of an x-ray here on my screen on YouTube. If you do have misalignments in the spine, over time, it can start to break down the discs in the bones, causing something we refer to as arthritis or degeneration. So we want to prevent that and restore the normal alignment of the bones so they're nice and square and good spacing between the bones. But the healing can take time because often there's a process of it breaking down. So maybe you have an injury and then the body adapts to it. Then the inflammation gets worse and eventually you get pain and discomfort. Maybe you try to medicate that yourself or try self-care. That's not working. And then eventually you go see a doctor to get some help. So we see people usually when the injury or the issue's been there for a while. And so when we go to correct that, it can take time as well. So I generally say the first phase of care is just getting people out of pain. Number 2 is correcting their posture. And number 3 is maintenance and prevention so that the problem doesn't come back again, so they don't shift back out of place. And it depends, like if it's been there for a long time, it's going to take longer to heal. If it's just developed recently, it could be really quick. I generally say this process takes weeks to months to go through. And as time goes on, we see people more often at the beginning, but as time goes on, we give them some stretches and exercises to do, strengthening. We even give them a meal plan, a 7-day meal plan to help with their nutrition. We talk about posture and sleep. All of those things are really important because that helps for the patient to take responsibility and care of their body as we work on it. So those are the phases. These are the different conditions that we see. If you have any questions about chiropractic, feel free to type that in the chat here. I'll respond to it. And if you're watching this later, you can type in the comments. Definitely like this video. Also, you can subscribe to our channel on YouTube. Here, you can follow us on social media. And I hope you guys learned something about chiropractic today and how it works. I'm on live on Instagram as well.